All right, I wanted to cover rational emotive behavior therapy, or REBT. It was created by Ellis. So Albert Ellis, again, was trained in psychoanalysis and traditional psychoanalysis, like the Freudian psychoanalysis that we've been talking about. But he got disillusioned, didn't feel like it was a good fit, didn't feel like it was working. So he moved toward a more directive, active, cognitively based model. He basically integrated behaviorism that was happening kind of in the scientific research world with philosophy and psychology, kind of integrated them all together to create REBT. He also contributed some of his influential thinking to Adler as well. So you may see some similarities in kind of how they view human nature and things like that within the two models. He has written tons. Albert Ellis has lots of different journal articles, writing, so you can find all kinds of his work out there. He also continued to practice as a counselor for many years, so that he has a lot of videos out there that you may even also see of kind of his clinical experience and him teaching REBT modeling and things like that. So he has a prolific amount of content and material that you can find when you go into researching REBT. The other thing that is kind of important to know, REBT is known mostly as REBT, but you may also find other places where it's cited as cognitive emotional behavior therapy, is that is another name that he also called it at different points in his theory. So Albert Ellis's fundamental view of human nature really is this, that it's never the events that happen to us that make us disturbed, but our view of them that makes us disturbed. So it's very based on constructivism and perception, and kind of how to do that, how to change our perception can change our behaviors. So it's very constructivist. It has some determinist flair to it as well, because he believes that humans are biologically programmed, but we can change our thinking and change our behavior through our thinking. So it has some qualities. He's kind of in the middle with determinism. That we're definitely influenced by our biological programming, our biological nature, our learning, that we have to kind of overcome some of the learning patterns that we have. But we are ultimately responsible for our behavior and our thoughts, and so we can change at any point. He believes that human beings are motivated by surviving and by being happy, so we try to avoid pain and threat, and we try to seek out pleasure. And part of that is to be loved and be comfortable and successful. So those are some like sub goals of that human surviving, right? We're a little bit more sophisticated than animals. So to be loved and comfortable and successful is the sub goals there. We have a natural predisposition towards self-preservation, that survival, that happiness, peace, self-actualization, loving, communication with others, thinking, and self-talk. We have a potential for rational or rational thinking, self-talking, self-evaluating, and self-sustaining. So that metacognition piece is really important to your cognitive therapies. It is here as well that we understand that we're thinking and we're talking to ourselves through our thoughts in our head, and that we can change that. So we can learn faulty thinking, and we can also unlearn that faulty thinking. It's very key to these theories. So the major premise of REBT includes that people are dogmatically driven to live their lives according to these thought patterns, and they can be irrational, they can be very personal philosophies of life that can get us caught in patterns that are really dysfunctional for us, and we can't get ourselves out of it necessarily easily on our own. So irrational ideas cause people great distress and misery. They're boiled down to a few basic categories, which we'll talk about. Counselors can help them find those irrational categories. We can teach them about them and help them find the thoughts that fit within them. And once we successfully teach them to catch those thoughts and to see what they are and learn another way of thinking, they'll be able to feel and do better. So that's what they're doing, right? Philosophical restructuring. We're restructuring how they think. And by doing that, we can help them eliminate some of the emotional distress that they're having. We can change those emotional problems. We can also change their behaviors by changing those problems. So we use, REBT therapists use both cognitive strategies and behavioral strategies. So you're going to see some techniques that are similar to behavioral therapy, right? And you're also going to see some techniques that are probably very similar to cognitive therapy. So they kind of are integrating those two in REBT as well. So the view of emotional disturbance is really irrational thinking is learned from others. We learn it from our social environment. So there's a little bit of a social learning piece there. And that self-repetition keeps we're in a circular loop that keeps the thinking alive. So we kind of are self-fulfilling prophecy over and over again. As we think, we do, then it happens, then we do, then again, right? Blame is the core of most emotional disturbance. So it's that external, the world's fault, it's your fault. And then we don't ever change. Desires escalate into shoulds and musts that create emotional unrest. So shoulds and musts are really important to Albert Ellis and into this theory that we basically set ourselves, others, and the world up against this ideal that doesn't exist oftentimes. So we should be this way, they should be this way, the world should be that way, and it just isn't that way. And that's creating that distress. So that difference between our shoulds and what reality is our emotional unrest, our emotional disturbance. So irrational ideas are ideas that lead to self-defeating behavior. They're not surviving, right? We're not surviving well, right? We're doing something that pragmatically is hurting us, and that doesn't really make sense, right? So they're irrational. So some examples are, I must have love and approval from all people in my life. I must perform important tasks competently and perfectly, must be perfect. If I don't get what I want, it's terrible and I can't stand it. Not true. Most of those are just not true. We can live through lots of things that aren't perfect. So the key concepts here, again, is very similar to cognitive therapy, that there's an activating event. Sometimes it's even just a thought that pops in your head, but usually there's an experience, something that's happening, and then you move to the belief about it automatically. There's a belief that comes with that. And then out of that becomes your consequence, your emotional or behavioral response to that belief, not the event, but to the belief that you're having about the event. Right? So they all interact. That ABC model is very present here as well as in cognitive therapy. So you'll see those both. Beliefs are declarative sentences, things that we say to ourselves. Collective beliefs are our life philosophies, how we live our life and what we believe about the world and others. Rational logical beliefs have support and they're pragmatic. So they have evidence through our experience that this is true, and also that they are helping us function better. They're pragmatic. So there's 4 kinds of rational beliefs. Anti-awfulizing, so that's just saying, it's not as bad, like I can live through this. It's not something that's gonna destroy the world. It's not the end of the world. So it's anti-awfulizing, those thoughts that say I can live through this, I can handle this. The flexible thought patterns, we shift as we need to think about situations and people differently, and we don't try to use the same logic for every situation and every person, right? So that flexible thinking is really important goal as well in this. High frustration tolerance, that's the I can handle this too, like it's not the end of the world, I got this, I can do this, I can handle being uncomfortable, I'm going to still manage through this, right? And then acceptance, and that's a lot to do with accepting other people's being human and ourselves being human, right? That we all have worth even if we fail. That is really important in REBT as well. So those are the kind of the categories of rational adaptive thinking. Those that are irrational also kind of fit into categories, like I said, and we teach the clients in REBT, we teach the clients what those categories are, and then help them catch those thoughts and identify them and shift them to something that's more rational. The rational thoughts are rigid, demanding, musts or shoulds. They're illogical, they're unrealistic, they do not help you function well, they're not pragmatic, they're not grounded in reality. So the self-demanding is, I must, blah, blah, blah. I should be perfect. I must get an A. I have to have this a certain way. So that's, setting yourself up against unrealistic standards, usually. Other demandingness, you must not behave that way. You must not treat me that way. You must blah, blah, blah. You must do this and that. That's, again, usually setting others up against something that's unrealistic. And then the world demandingness. This should not happen. This is unfair. Right, it's unrealistic to expect bad things to not happen. So those sorts of things. Other irrational thinking patterns is awfulizing. This is the end of the world. I'm gonna, if I fail this class, everything's gonna just be gone. That, right? It's predicting doom. I cannot stand it. That's a little frustration tolerance. I can't stand it when blah, blah, blah. I'm not going to be able to manage this. No, you probably live past getting the C, right? You would live past things that you really think are awful and you can't stand. Damnation, things that are absolutely horrible. And they just, that black and white thinking, it's either amazing or it's awful. Absolutely horrible. And then allness or overgeneralization. That's just applying certain thoughts to every situation or every person, and it's just not realistic. Situations are complex and people are complex, so it's not going to fit. That overgeneralization thing. Irrational beliefs become circular reasoning, right? So they oftentimes will lead to thoughts and feelings that actually cause some of the events to happen, and then they keep going. And they go around and around and they don't change. So it's disrupting that pattern. A healthy person in this theory relies mostly on rational thought. That's important, that they're realistic. They also have unconditional self-acceptance, which is really important to this model as well, that you accept that you're human and that you may make mistakes, that you are on a path of learning to be better. That's really important, so that accepting reality and accepting yourself as a real person and that your needs, wants are important, that kind of stuff is really important as well. Healthy basic philosophies that value flexibility in your thinking patterns and in your behavior. Psychological healthy is relativistic thinking and desiring. It's understanding kind of what reality is and what you can achieve. Balance of self and social interest. I think that's one that's sometimes lost a little bit in the theory because it talks a lot about, seeking pleasure in things, but you're also doing so in a reasonable way that is also helping you make love and connections and things, right? So that social interest is a piece that sometimes gets lost, I think. That there's a balance between your wants and others' wants. The values long range hedonism, self and social interest, high frustration tolerance, but works to change disliked situations. So you can tolerate lots of unpleasant things, but you're also working for better. You're trying to grow and make their situation better. Dysfunction within this area, an unhealthy person is operating primarily on irrational thoughts. They self-down them. They're putting themselves down. There's a lot of hostility and rage and frustration because other people aren't living up to their unrealistic expectations or the world isn't, right? And they have low frustration tolerance. They get really upset quickly and give up quickly. Demandingness is a core of the psychological dysfunction. So they're demanding the world be different. They're demanding themselves be different. They're demanding the situation be different rather than adapt and change their thinking pattern to fit reality, right? Awfulizing, frustration, intolerance, global condemnation of human worth, severe dysfunction due to early experience and innate organic deficits. So again, it's connecting that biological piece that maybe there's struggles within them biologically, and also that they've learned this faulty thinking. So that early learning experience is important too. So there's both that can lead to more severe dysfunction. The therapeutic process in REBT is an educational process primarily. So you're educating the client on the REBT philosophy and model and how to shift their thinking patterns. So clients are learning new thinking ways, but you're helping them along that process. Clients are supposed to have goals that help them contribute to their sense of purpose, their sense of worth, and that the overall overarching goal of REBT is that they have a rational philosophy, a rational approach to life that helps them survive and be happy. So it helps them meet their goals of survival and happiness. And usually that includes loving connections with people and being successful as far as just getting the things they need in life, right? So again, through that, we're teaching clients the REBT philosophy, helping them identify and dispute irrational beliefs, and help them replace them with more effective ways of thinking, more rational, realistic ways of thinking, and stop the absolute blaming patterns of false beliefs that just keep repeating. And not just in this area are we focused on thinking better, but that is the primary motivator, primary change, the catalyst for change. So you help them think better, and if they think better, then they feel better and do better. So thinking is the primary change agent that we're working on, but then it leads to changes down the road as well for other things, feelings and thoughts. So again, that unconditional self-acceptance is also a piece of this that they're trying to increase that in clients as well. Therapeutic alliance is important. It's an active, directive approach. The counselor is seen as authoritative with the unconditional self-acceptance. So they are very clear that all human beings are worth something, and they will challenge that with the clients who are self-doubting, right? So they are very authoritative in that. That's not true. So they will correct clients on that one. Assessment happens lots of different ways, both formal and informal. It's a continuous process. They do use the DSM and self-report instruments to kind of get information. They also do like the clinical psychosocial interview, right, to get background information. They also do a more problem-focused interview that's focusing on their thought patterns and the behaviors that are not that are dysfunctional, that aren't pragmatic in their life, that's not working for them, right? So they do that problem-focused piece so they can understand what's not working for the client. The therapist's role in this is to teach the model and to demonstrate irrational, to find and demonstrate the irrational pieces of that. So you're showing them how the thought is not making pragmatic sense, or how it's not got evidence in reality, and helping them identify that and then help them shift it. Help them see that their problems, their emotions, their behaviors are all maintained by that thinking pattern. And if they change their thinking, then they can change the way they're living their life, right? So that's the therapist's role. The client's role and the interaction with them is just basically to kind of learn, to listen, to try things out, is the client's role. It's the interactions, non-judgmental. It's evaluating that thinking pattern. Sometimes humor is used to kind of joke about the illogicalness of things. It's open, direct. Transference is viewed as faulty thinking and treated as such. There isn't any necessarily focus on dream work or the past childhood, digging into that, or free association. So it's kind of went away from all the techniques of Freud's time and really focused on this REBT model, which we'll talk about in a little bit. So this is the main technique that you will use over and over. You teach this to your clients, and then they walk through it, and you go through it again and again, and you have them do it as homework. But basically, it's disrupting irrational beliefs. So it's the A, B, C, D, E. Some people put the F in there for feelings. I just include F as part of E when I talk about this. So activating event is the thing that's causing this belief pattern to get set in motion. Sometimes I would say that this could even just be a thought that happens, it pops into your head, but usually there's something that triggers those beliefs to happen. So the activating event causes a belief to pop in. And the belief is actually what causes us the distress that we have, or our ability to function. So the belief could be rational or it could be irrational. So you have the belief, and then you have the consequence that follows that. And the consequences are typically emotional and behavioral. So you're either going to do something, you're going to react, or you're going to feel something about the belief, really, not necessarily the event, but the belief is going to cause you to feel or behave a certain way. And then what you're teaching the clients is to be aware of those belief patterns, to catch them and dispute them. So then you challenge them, the rational thoughts. Is this really true? What evidence do I have? And you go through these questions, which we'll talk about in a bit, to dispute it. Then if you dispute it, you're going to most likely, and this is what RBT is suggesting works, is that you'll have a new effect, a new outcome. And the new outcome is usually a new belief about this, yourself, the others, or the world, or new feeling about the situation that you're in. So it's either, new way of thinking or a new feeling, and you can do something different, right? Then you're not reacting, you're responding, and then you'll have a new behavior as well. So you're going to be doing differently. So in order to dispute irrational thoughts, that D in the model, you talk about these kind of irrational thought areas. Is it functional, like pragmatic? So you're detaching the client from their core belief. Is this really working for you? How does this result? You know, if you're thinking this, what's going to happen? You're just examining that pragmatic belief of what's going to happen if you continue this way, continue thinking like this. What's happened in the past when you thought about this? Is it really working for you? Functional. Empirical is that what evidence is there to support that everybody hates you? You know, like, is that really true? Right. So it's taking that thought and asking them what evidence do they have for that. There might be some, there might not be some. Oftentimes, if you're going this route, there isn't very much, right? So it's not everybody, you know, it's that all or nothing thinking. It's a generalization. There is some illogic to that. So you're pointing out the evidence doesn't actually support their thought. Logic that is focused on faulty logic is not consistent, right? So is it consistent across all people? Is it consistent across all situations? You know, your logic can't just change. It has to be logical all the time. And so it's pointing out times when their logic actually is not actually happening. So they believe they're a failure. No, actually, weren't you really good at this one thing over there? Or didn't you do that? Just because you're not good at spelling does it not mean you're not good at math, right? It's pointing out the logic doesn't fit everywhere. And then pragmatic, functional, same philosophy, focused on life satisfaction. If you continue to think this way, you know, how likely are you going to be happy in life? Or is there a way to like shift the way you're doing things or thinking about things so that you can be happier? Because they may not be able to change their situation necessarily, but they can change the way they think about it. So if they just can replace I can't do this with I can tolerate hard stuff, I can get through hard things, then they're going to more likely be more satisfied even in a difficult situation, right? So it's shifting that philosophical approach to life so they can deal with things that are difficult in life. Other therapeutic techniques that are used in REBT, bibliotherapy, stop and monitoring. Oftentimes they'll have you monitor your thoughts and journal about thoughts and things like that. So it's that metacognition that they're trying to get clients engaged in so that they're catching illogical patterns and shifting them. Reframing, that's often done with humor sometimes. It's a skill set that is used across all counseling methods, but this is oftentimes reframing their thoughts, right? Reframing what they're doing. Cognitive homework, again, like I said, oftentimes logging things, journaling about things, changing one's language. You catch the shoulds and musts and you change them and you have them replace it with things that are more flexible, rational, right? So instead of I have to get an A, I prefer to get an A. I have to get this raise, I prefer if I get this raise. I'd really like to get this raise. So it's shifting the thought pattern so it's not these absolutes. I can't live if I don't have this, right? But I prefer life to go this way. I can probably get through it if I don't have it go that way, right? And so it's looking at that and shifting those language that they're using. Rational coping statements, again, like I said, just talking about things in a more coping strategy way. Rational emotive imagery, and that's just thinking through and imagining what the outcomes are going to be one way or another. Shame attacking, oftentimes that's focused on that unconditional positive regard, that self-acceptance of themselves, right? So it's learning how to point those out. Force and figure, I think that comes a lot from Albert Ellis's style of doing REBT. He is pretty harsh. If you ever watch any of the videos of him, he is pretty harsh with people. That is not everybody's approach to REBT. So that is his personality coming out. And a lot of times this method was criticized because Albert Ellis was that way. But you don't have to be as forceful as that. And you can be more, you know, you can use humor to lighten things. You can use all kinds of gentle disputes of people's illogical thinking. So I think that that's something that needs to be, the techniques can be put into your personality, and that's okay. I think that is, but they definitely will challenge those thoughts. Those thoughts are persistent, so you definitely have to be consistent with like catching them and challenging the client's thoughts. Some of the more behavioral based approaches I put over there on the side. So skill training, again, you're teaching them assertive assertive communication, right? You're teaching them some new ways of being that maybe they didn't learn from their environment. So that's an important piece of this as well, that you might be doing some of that. In vivo desensitization, that again is oftentimes with anxiety. You're going to put them in those experiences. You're going to imagine those experiences. You're going to, maybe give them music to make them think they're in that experience, whatever, right? And then you're going to help them talk themselves through, again, changing the thought patterns that are going on while they're experiencing the situation they feel like they can't handle, and helping them learn that they can handle it. Reinforcement and penalties, again, that is behavioral therapy kind of approach, but you can use it with REBT, right? So it is partly in here as well that you want to help them realize that rational thinking also leads to better behaviors, better outcomes, so that they're reinforcing those behaviors, reinforcing those thoughts are important. Placing penalties, punishments on thought patterns or behaviors that don't work out well pragmatically or aren't realistic may be a big piece of this as well. So you may have some behavior contracting and things like that as well with this, depending on how you want to approach it. Also role play, again, that's practicing those behaviors, practicing those thought process. You may have them to repeat verbalizations out loud. You may have them repeat the I prefer, blah, 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 instead of I must or I should, so that they can practice those new behaviors, practice those new thinking patterns. So as far as social, cultural, religious considerations, it is a very active directive approach, which fits some cultures better than others. So keep that in mind, that some cultures want more of a directive, authoritarian kind of counselor situation, and others maybe not so much. Ellis, like I said, Ellis's personality was personal. He's just abrasive kind of person. He would put clients down at times. I felt like he was very confrontational in his approach. So that has led to some criticism about the approach being really too harsh and directive, but I believe that's really his personality, and that you can use REBT in a very soft and gentle way. It is intellectual. So I think this is important, especially coming at this from a person who's worked with a lot of children. You may not be able to use this with certain kids, right? Because their cognitive ability is just not there yet. So I would say probably above the age of 10, 8, somewhere in there. Typical kind of thing, or very intellectual kid, or if they have a cognitive disability of some sort or a cognitive delay, this may not be a good approach for people who aren't able to metacognate and really catch their thoughts and really focus on that and shifting them. So you want somebody that has a pretty, at least average or above average IQ. Long range hedonism may be problematic for some, particularly religious people, or just depending on the cultural values and things, that's something to keep in mind. Sexual liberalism and tolerance of self and others maybe make this more applicable to some people, particularly with a diverse sexual orientation, or something that doesn't quite fit in the box of what's typical, because it allows them that open-minded tolerance and I would say acceptance, because it's talking about acceptance. I don't really like the word tolerance. Acceptance of themselves, acceptance of what they want in life to make them happy and help them achieve happiness, right? So there's that piece of it that's helpful. It focuses on the individual, and so it may not be a good fit with clients who come from our collectivist cultures. And it does not really deal very much with oppression at all, or oppressive forces. It does take into account like environmental pieces, right, that contribute to our social learning, but it focuses on change within an individual, not change outside or not change of the system necessarily. So it may not particularly work well for those clients who are struggling a lot with oppression and oppressive forces. It minimizes and neglects some cultural differences possibly. So those are kind of some criticisms and some considerations as far as REBT goes. As far as advocacy and research on REBT, there's some problems with the testability of theory. Oftentimes any theory that's got insight development that is part of it is kind of tricky to test for that insight development part of it. There are some studies that report positive findings for using REBT, and there's a lot of outcome studies that support REBT use, that it's effective, that they have some of the outcomes that they're wanting their clients to have. It's probably as effective as other approaches, is kind of what it's been found. But overall, as with most theories, there's some conflicting results on how effective it is versus other theories. So in summary, REBT is really about our beliefs. So our beliefs about the events are what cause us emotional and behavioral distress, or our emotional behavior response is based on our beliefs, not the actual events. And if we change the way we are thinking, then we can change the way we feel and the way we act. REBT's primary mode of doing that is following that ABCDE model, so that helping clients be aware of their patterns of thinking and patterns of behaving in order to change that. So that is REBT very quickly.